Welcome back to Health Check. I'm Heidi Godman. If you are just joining us, my guest today is Dr. Manjula Jegasothy, a Harvard and Yale-trained cosmetic dermatologist, also founder of the Miami Skin Institute. We're talking all about how to get healthy, glowing skin. So she has suggested that you can attempt this at home. And if you're younger and you don't have a lot of skin issues, then she says just an exfoliating wash might be all you need. If you're a little bit older and you notice a little more dead skin cells, then maybe you would want to use one of those electronic brushes and do it every day. But if that's not working out for you, you can go to see a professional. And when people go to see Dr. Jegasothy, she might talk to them about a chemical peel or microdermabrasion. So we want to find out a little bit more about those things. So a chemical peel, Manjula, we used to think of those as those awful, awful procedures, and you would see friends you had getting a chemical peel, they'd be peely for weeks.
Yes, I mean, many patients even now ask me, is it going to be like, if you remember Samantha on Sex and the City, where she had a chemical peel and had to hide behind a black veil for like a week? It's definitely not like that anymore. The modern peels, they don't work by actually taking off layers of skin. They micro-exfoliate the dead skin, meaning microscopic amounts of skin cells are shed in the 1 to 2 weeks after the peel, which you don't even notice. But more importantly, they work at the cellular level. These are fruit-derived acids, and each one does a different thing. For example, glycolic acid goes into the skin cells and plumps them up and also causes them to live a little bit longer so they don't shed as quickly. Another acid, for example, I use commonly is salicylic acid. Salicylic acid is one of the few that actually is able to go into the pore and to dry up oil. So it's fantastic for when you want to use for acne-prone skin or to exfoliate, to dry up oil or to even unclog a pore. Then there's another one, either mandelic acid or pyruvic acid, which we found has gone into the brown stained skin cells and actually reduces pigmentation in the cell. So they all work at very complex cellular levels now, and it's all been very highly studied so that you get results without the downtime.
All right, and tell us how it works. What happens when you get a chemical peel? You brush something on the patient, or what happens?
So they come in, and one thing I ask them is to have not gotten any direct sunlight, meaning not have gone to the beach and laid out or to the pool and not have gone on the boat or whatever for 3 or 4 days prior to the peel. They can have normal casual sunlight, meaning going to the grocery store, going out, going to the car, etc., but no actual, tan. And then we put the peel on just lightly, generally with a gloved finger and a gauze, and they sit with that. It itches mildly. It doesn't really sting or burn even. It just mildly itches, and we put that on for about 5 to 10 minutes, depending on the patient's skin type, how much sun they've gotten in their past, what they have, going on that week in terms of sun exposure, etc. And then we have them rinse it off in the office with us, and so we make sure that every bit of the peel has been taken off and neutralized. And then afterward, the patient is red for maybe 3 or 4 hours. So generally, I tell them don't go out that night. And then by the next morning, their skin is already glowing and looking better. If they had a specific issue that I was trying to fix, like brown spots or pores or something like that, that might take 2 to 3 weeks to fully see its results.
Okay, so what is that 2 or 3 weeks like? What's happening to the skin at that time?
It's just slowly improving. It's getting brighter. It's starting to glow. Brown spots are starting to fade. The pores are starting to shrink. The bumps are starting to disappear. It's just improving over time. The only recovery is that redness that you have for the first day.
Okay, so redness for the first day, but otherwise you don't see any peeling, you don't have any of that.
Yes, and you don't have anything bad happening. The skin just continues to improve over the course of about 2 to 3 weeks.
Now, how long do those results last?
Those results typically last about 6 weeks. So the average patient I generally see around every 2 to 3 months if they want to maintain their results with the chemical peels. Now, if I'm treating, again, a specific condition, such as brown stains or brown spots from the sun or acne or something like that, then the patient may get 2 or 3 peels like this every 6 weeks, and then they may be put on a maintenance where they just come and see me every 3 or 4 months. That means about 3 times a year, and just do it for maintenance in that way, and they can keep their skin looking good, really, for an indefinite period of time.
Okay. Is there a point when you can't do those kinds of peels anymore, or is it unlimited?
No, it's definitely unlimited. And in fact, I tell them, even some of my oldest patients, that even if Botox and the fillers and laser is not really doing the trick for you anymore, you might need surgery or something like that. Chemical peels will still always help your skin look fresh and your pores look small, and just help all the textural things that can occur on the skin. So there is no age limit for peels.
Okay. And then the other thing that you mentioned as a way to get that skin glowing and looking healthy again is microdermabrasion. For people who aren't familiar with it, tell us about it.
Microdermabrasion is interesting. It's basically a mechanical exfoliation, very similar to what you would get with the Clarisonic or some other electronic brush. However, it's much stronger and much deeper. With the microdermabrasion, there is a machine called a microdermabrator that the skincare professional uses, and it basically has a handpiece that shoots out a crystal that then abrades the surface of the skin. So you get a mechanical exfoliation of the skin surface. So this is great for people who have those kind of warty keratosis growths, or if they have just dead skin without having any dryness or pathology underlying it, such as menopause. If you just need a quick freshener, quick brush up, it's great also because it doesn't really leave you with any redness. So it's something you can do a day or two before an event just to make your makeup glide on more smoothly and just have a much smoother appearance for your event.
Tell us how it works when you go to get a microdermabrasion treatment.
So you come in, there's no preparation except to wash off your makeup, and then the skincare professional basically applies the handpiece in a linear fashion, going in strokes upward along your face. That's one pass, and she'll do your whole face that way, and the crystals rub the skin and exfoliate it. And then she may do a second or third pass in a different direction to make sure that she gets all of the areas. Afterward, there's like a little blower where she'll blow off or brush off the crystals that are persisting on the skin. And then you can walk out. You're not red. You're not anything. Your skin just feels really smooth and really soft, and there's no recovery.
All right, and you mentioning that the esthetician is doing this. For people who don't live near you, who might want to go get microdermabrasion somewhere, what should you look for in a person who's going to be doing this to you?
I think that you should make sure that the person is a licensed esthetician. They have to display their licenses on the wall. Microdermabrasion is a very popular procedure done in most medi spas and even just regular salons and spas. So I think the thing to make sure is that you go to someone who is a licensed skincare specialist, not someone who's just doing microdermabrasion and has no training.
Okay, very interesting. And then how often would you get microdermabrasion?
You can get microdermabrasion as often as every 2 weeks, since there's no recovery and it's just a surface mechanical exfoliation.
All right, very interesting. So those are ways that you can go ahead and get rid of those outer layers of the dead skin. But then how do you maintain that at home? I mean, if you've got the microdermabrasion treatment, do you go home then and then do some exfoliation, or do you have to be careful? Tell us how you maintain it.
If you want to be diligent to maintain it, the best thing to do would be to use a glycolic cleanser. And one of my favorite over-the-counter brands is Neutrogena's AHA cleanser. That's capital A, capital H, capital A. AHA is the sort of scientific term for glycolic acid. So you just use one of those cleansers and the Clarisonic brush, and then you can maintain your results.
Wonderful. Dr. Manjula Jegasothy, so much fun talking to you. I really appreciate it. I hope you'll come back on the program.
Thank you. I would love to come back, and thank you so much for having me.
And tell us how we can find out more about you and what you do.
Sure. My practice is in Coral Gables, Florida, but I have a lot of great information online. You can find me at realself.com. You can find me on my website at miamiskininstitute.com. I have a great Pinterest board with before and after pictures of all my procedures. I tweet, and I'm on Facebook, and all of it is under Miami Skin Institute.
I love it. What a media-savvy doc you are.
Thank you.
And Harvard and Yale trained. Love that, too. All right. Thank you so very much. Great talking to you.
Thank you so much, and have a great day.
You too. And again, everybody, if you're interested in finding out more about Dr. Jegasothy, you can check out her website. MiamiSkinInstitute.com is how you can do that. And if you'd like to find out more about Allison Connick, who I was speaking with earlier in the program, you can check her out at BayviewDental.com. So we have MiamiSkinInstitute.com and BayviewDental.com. And you can also get a hold of Allison by calling her directly, 953-4288 for Dr. Allison Connick. That's going to do it for us. I'm Heidi Godman, and my producer today has been the adorable John Hanson. We call him JR sometimes when we're in the mood. And you've been listening to Health Check with Heidi Godman on WSRQ. We'll talk to you again tomorrow.